Watch, listen, learn. Welcome to BCC on iTunes U.
ABO and RH typing is the most common task performed in a blood bank laboratory. This is actually 3 little tests combined in one. The first part, the forward type, looks for antigens on the patient's red blood cells. This determines the patient's blood type. The second part, the RH typing, looks for the presence or absence of RH antigens on the patient's red blood cells. This will determine whether the patient is RH negative or RH positive. The third part, the reverse type, looks for the corresponding antigen present in the patient's plasma. We begin by spinning our patient sample in order to separate the red cells from the plasma. Using a marker, we label up our test tubes for our forward and reverse typing and put them in our rack. We also label up a test tube for our red cell suspension that we will make with our patient's red blood cells. We begin by dropping in our reagents into the corresponding test tube. For our forward type, our A and our B, we put 1 drop of anti-A in our A tube, 1 drop of anti-B in our B tube, for the RH typing, we're going to use anti-D, 1 drop into our RH tube, and 1 drop of RH control into our control tube. These are manufactured reagents containing antibodies that will detect the presence of antigens on the patient's red blood cells. For the reverse type, we are looking for antibodies in the plasma. So we need to use red cells that have known antigens on their surface. So we use 1 drop of A1 cells, one drop of B cells. Now that we've pipetted our reagents, it's time to add our patient sample. Using a transfer pipette, you want to draw up some of the plasma from your patient sample and place 2 drops of plasma into each of our reverse tubes. Now we want to go down into our red cells and drop a few drops of packed red blood cells and place it in the tube where we will make our cell suspension. We use 0.9% saline to dilute the red cells to a 3% concentration. And now add 1 drop of this cell suspension to each of our forward and RH tubes. Give the tubes a little shake and centrifuge for 15 seconds on high speed. Now we need to check for agglutination. Hold the tubes between your middle and your thumb, and you want to shake gently to dislodge the cell button that has formed on the bottom of the tube. Check for agglutination. If the cells come off in one large chunk, that means there is agglutination. In this case, we have agglutination in both our A and B tubes, indicating that there are A and B antigens on our patient's red blood cells. Now we read the RH and the RH control. We have agglutinin in the RH tube. This means that there is RH antigens present on the red blood cells. Therefore, this patient is RH positive. There is no agglutination in our RH control tube. We always expect this reaction to be negative. If you were to get a positive reaction in your RH control, your testing would be invalid and everything should be repeated. Now we will read the reverse reactions. Check again. We have no agglutination in either the A1 or the B cells. This indicates that there are no anti-A or anti-B antibodies present in the patient's plasma. We would expect this reaction because the patient does have A and B antigens on the surface of their red blood cells. Remember that we never make antibodies against antigens that we have present on our red blood cells. At this point, we can interpret our patient as AB positive.